Honestly, I would say it's leadership, Anjali. We've got organizations that have historically not necessarily given priority to these topics. You see a lot of talk coming from across the healthcare industries, entities that are, saying that they believe in health equity, saying that they believe in disparities reductions. But when you actually look at the real investments that they're making, they're small and they're insignificant in the context of the broader challenges we face as a society. And so, my view is that, while there's a lot of rhetoric that's being devoted to serving, underserved populations, the true investments that are being made are actually quite limited. And so I think when I think of solving these problems, I think where it needs to start from is ultimately leadership and more organizations making real commitments as opposed to just the window dressing that we've tended to see. I think the window dressing has created the impression that organizations are trying, and because the metrics haven't necessarily moved, it's making us feel like, our efforts are failing. Mm-hmm. I would say the efforts have just not been significant enough, deep enough, or impactful enough because they haven't necessarily been at the center of an organization's strategy. A lot of what we're trying to prove at SCAN is that when you actually set these priorities and make relevant investments, you can not only move clinical outcomes and reduce disparities, but you can also move business outcomes, and that's our goal. We're not doing the Affirm product, the LGBTQ plus product, purely for altruistic reasons. We actually think that there's a market that is underserved here and where we can actually grow share. And so I think that there's this interesting moment in time when there's an alignment of business interests as well as doing the right thing from a social justice perspective.